Good afternoon, everyone. Welcome to Yale Sleep Medicine Grant Rounds. My name is Hira Bakhtar. I'm one of the faculty at Norwalk Hospital, and I'd like to make a few brief housekeeping announcements before introducing today's speaker. Please take a moment to ensure that you're
Fine.
to receive CME credit for attendance. Please see the chat room for instructions. You will need to sign up to receive credit. If you have not done so, please send a message to Debbie Lovejoy. If you think anyone else would be interested in joining us, please reach out to her as well. I will be moderating the session, and later on, Dr. Weir will join to moderate the session. If you have questions or comments during the presentation, please use the chat room or take the opportunity to unmute yourself at the end of the talk to ask your questions. And recorded versions of these lectures will be available on YouTube a few weeks after the presentation. And now it is my pleasure to introduce our speaker today, Dr. Reema Iqbal. She's one of our fantastic sleep fellows at Norwalk Hospital, and she will be sharing her insights on consumer sleep technology. And I'm looking forward to this talk. I want to share a couple of fun facts about Reema. She is fluent in American Sign Language, among many other languages, and it has been very useful for her. And she shared with me that one time she was waiting for an interview and she saw a patient asking for help in the American Sign Language, and she was able to do that. Of course, I can't do that. The other thing I'm really excited to share about her is that she shares a book club with 15 of her nieces and nephews, and she's extremely proud of that. So please join me in welcoming her and learning more about this sleep technology from her.
Thank you so much, Dr. Bakhtiar, for the lovely introduction. My name is Reema. I'm one of the sleep medicine fellows here. So today I'll be talking about advancing patient-centered care, especially in sleep medicine, and particularly focusing on consumer technology. So without further ado, so I have here just a disclosure before starting the presentation. I'd like to share that this disclosure page states that I have no conflict of interest, and this code is the code for CME if anyone would like to use that. And some of the learning objectives for today. As a sleep medicine fellow and a sleep trainee, I've noticed the growing reliance on consumer wearables by patients seeking answers about their sleep, often bringing data to clinic and trying to get explanations for their fatigue or insomnia. And, you know, in these visits, they're armed with their Oura Ring or Apple Watch, and they wonder why, despite having 8 hours of sleep, they still feel tired. Today, I want to walk us through like the promises and pitfalls of these devices in sleep medicine, how we as physicians can responsibly engage in these conversations and evolving landscape that's coming forward. So before I start talking about the topic itself, I actually want to discuss a case that I saw this week with one of my preceptors, Dr. Weir. And the patient came in, his chief complaint was, my watch says I have sleep apnea. And he was our 81-year-old male, had past medical history of hypertension, hyperlipidemia, cataracts, and all he said was that my watch detected that I have sleep apnea and I want to be evaluated. Other than that, he felt great. He felt great during the day, didn't nap, his stopping, as we know, that's one of the metrics that we use to, one of the pretest probabilities that we use to see and assess. It was fairly low. And in many cases, I'm sure many of you have come across such cases as well. And this is why I want to walk through the evidence-based medicine behind this and what we're actually probably going to have to deal with moving forward. So, the global rise in awareness of one's sleep health and its systematic impact is definitely shifted now. The consumer technology has rapidly encroached on the space of the traditionally occupied clinical tools, and they offer unprecedented access to personal health metrics, and they raise questions about the accuracy and interpretation and clinical utility that we have. This surge in the technology has become so popular. Approximately, they say in 2019, approximately 30% of United States consumers owned a wearable device. And if validated, these devices could serve as an important tool in sleep research and clinical practice. So I'll walk through some of the research that has been done thus far and some of the other concerns we have. The current landscape, as we all know, is the gold standard diagnostics that we use to assess our home sleep apnea test. Polysomnography, actigraphy is something used. And these consumer grade devices include wearables, headbands, mobile apps. There's differences in data, quality, accuracy, and purpose. But some of the questions I really want us all to keep in mind is, how much time are these patients spending on sleep tracking? How much money is being spent on this? What percentage of adults in the United States are using some form of sleep tracking? And these are just a quick overview of many of the different devices in the market. They keep changing. They're constantly being updated. And the market is definitely inundated with it. Some of these were used in research that I'm going to discuss later. These are just quick pictures. And as newly reported, we all know in 2024, Apple Watch received FDA clearance for sleep apnea notification feature. So this does not mean that the Apple Watch can diagnose sleep apnea, but it can possibly detect as per FDA. And this is very important, especially because a lot of our patients are now questioning this and, visiting the offices because of this. The clinical trials that were done had a broad study population of normals and anywhere between normal to severe sleep apnea, a total of about 1,448 they report. And based off of that, they looked at the sensitivity of this product and the specificity. And findings really didn't really show much promise in terms of sensitivity. The sensitivity was about 66%, whereas the specificity was about 98%. However, they did also report that the Apple's sleep apnea notification feature is not intended to diagnose, treat, or aid in the management of sleep apnea. These are the numbers based off of their research. And some of the key considerations that I want us all to reflect on is the amount of patients that possibly are using some sort of sleep tracking device. That's about 35% as per Academy of Sleep Medicine in a survey that they did recently in 2023. And the total amount that's being spent globally as per the Journal of Sleep Medicine, global spending, which includes smartphone applications and wearables, surpassed 82 billion in 2021 and projected to grow more and more. As far as the research that's been done. So according to the Sleep Research Society, there was a study that was done in 2020. This compared 7 consumer sleep tracking devices with polysomnography. This is our traditional testing that we do in about 34 healthy adults. And that found that while some devices performed comparably to actigraphy, which is something that we do use in our clinic, however, discrepancies remained, and especially in detecting wake after sleep onset in those consumer devices. And those 7 of those consumer devices included 4 wearables, which were some of the watches that I showed previously, and then some non-wearables, which included Sense Live, ResMed, Sleep Score Max. But all of these compared to polysomnography were worse. However, some of these were even worse than actigraphy. And while the consumer devices showed high sensitivity for identifying sleep and the specificity for identifying wake was lower, and the ability to accurately track sleep stages was inconsistent, leading to overstimulation of total sleep time and causing more inaccuracy. So as far as the accuracy of these consumer wearables, many, if not all, of these new devices demonstrate promising initial validity for tracking sleep. However, after that, there's not much, and especially compared to our traditional testing, such as polysomnography. So there's poor performance in accurately tracking any sleep stages as well. And some of the data accuracy listed in that research paper included variability in device performance and obviously firmware updates. These devices tend to miss brief awakenings and inaccurately classify movements as wakefulness. Factors such as skin tone, heart rate rhythms, and sleep positions can definitely affect the readings that they're getting. And overall, the devices show inconsistent data accuracy due to several of these factors. And shared beds and pets sleeping with patients also may distort the results for that. Um, there's a lack of standardization. Validation studies often show that low sensitivity and specificity for sleep stages and disorders. There's really an absence of universally accepted protocols for these devices, which really complicates things. And then more so than not, you want to see how the patient feels. And that's basically what we go by, the subjective feeling of patients. And users may tend to misread this data, and that leads to anxiety or inappropriate self-diagnosis. And the term is called orthosomnia. It's one of the digital age sleep disorders, I call it. The definition of this is a sleep disturbance characterized by anxiety and hyperfocus on achieving the perfect sleep. And it's often driven by data on from these consumer sleep tracking devices. And some of the key features that you see are, obsessing over your sleep metrics, increased sleep-related anxiety, difficulty initiating or maintaining sleep due to the fixation of that sleep tracker data. And there's definitely a discrepancy between sleep complaints that these patients come in with and the objective clinical findings that you assess. And these patients may present with insomnia-like symptoms despite adequate sleep duration, common among high-functioning adults using sleep wearables. I think it's very important to recognize this as a growing phenomenon and provide reassurance, emphasizing subjective sleep quality over raw metrics that these devices may show, as far as emphasizing the sleep quality. If they feel like they're getting enough sleep, that's great. Another statement by the Academy of Sleep Medicine. In 2018, they released this position statement where after a study, they had said that despite this growing public interest in devices and apps designed to monitor and improve sleep, they do lack rigorous validation and FDA clearance, rendering the unsuitable for diagnosing or treating sleep disorders. Clinicians are advised to approach patient-generated data from consumer sleep technologies with caution, and using it as a supplemental tool may be beneficial rather than primary diagnostic resource. So it's definitely to be used with caution. This is the statement that they had released. And some of the things that they discussed in that research paper was the disadvantages and advantages of these consumer technologies. Advantage being it creates patient awareness and patient interaction. However, it's not adhering to the HIPAA standards. There is an underestimation of sleep problem causing a delay in evaluation and treatment for the actual cause of their sleep concerns. All in all, having physicians tend to the side of just using that as a supplemental tool. So overall, the primary limitation is whether these devices contribute to a meaningful to management and treating insufficient sleep. I know like the #1 sleep disorder in the world is insufficient sleep. So there's really limited to no data on consumer devices and sleep extension. For me as a sleep physician, I want to know if we can use this to improve population health overall or individual sleep. So there was a study done, and this isn't a sleep medicine study, but this incorporates technology and medicine, similar to what the sleep world is doing. This was published in JAMA. It's the effect of wearable technology combined with a lifestyle intervention on long-term weight loss. It's the idea of a randomized clinical trial. So the question here is if adding a wearable activity monitor improves weight loss within the context of behavioral weight loss intervention. So the findings in this randomized trial, it's included 470 young adults over the course of 24 months, 2 years. Participants who received the behavioral intervention with a wearable activity monitor lost about 2.4 kilograms less than the those that were in the standardized intervention group. So meaning that the device that monitors and provides feedback on physical activity may not offer an advantage over the standard behavioral weight loss approaches. And contrary to expectation, adding a wearable technology to behavioral weight loss program resulted in less weight loss than one would have thought. And therefore, the study suggested that wearing a device may not offer additional benefits overall. And I wonder if that's the same case with sleep medicine and the sleep consumer wearables. Some of the consumer sleep technology and outcomes. So I want to ask everyone, the central question for consideration is whether consumer sleep technology provides meaningful support and the clinical benefit to patients in the management of understanding their sleep. Do these sleep technologies do what they intend to do? Perhaps with the general population health, this may show wellness and what we're seeing in the clinic. Both are equally important, of course, the general public, whether we see the patients in the clinic or not. However, do we as sleep physicians have the capacity to meet the growing demand without compromising the quality of care? Perhaps the greater public and physician awareness of sleep apnea will propel much needed changes in the healthcare system and access to specialized sleep care. However, without peer-reviewed evidence, the risks of people with subclinical sleep apnea being notified by their watches are harder to weigh. So I think of it like this: for that one patient that is wearing that watch, this visit may be beneficial, perhaps sparking them to address their modifiable risk factors like weight loss or smoking status, but they may have harmed another patient who needed that appointment at that backlog sleep physician's practice. So there comes that burden on the specialty and the physicians itself, which I think it's very important for us to speak about. Overall, I think these over-the-counter consumer technologies are increasingly encountered by patients, healthcare providers, due to the ease and integration of it and the technology that's comes with it. But these technologies have the potential to help raise awareness and promote education. However, we still have many questions surrounding their clinical significance, effect on the future of sleep medicine, whether it be the legal or social implications remain unanswered. Consumer sleep devices may catalyze the sleep health community to reconsider the number and nature and categorize biometric sensors, however, and may effectively diagnose sleep apnea, but I don't think that's very beneficial in terms of the data that we have. I think it's very important that as a sleep medicine community, it's to engage in this as something crucial to enhance personal and public sleep health rather than letting that intrude upon the sanctity of sleep. So overall, bottom line, they may be useful for wellness tracking, but not a replacement for medical grade tools like polysomnography or actigraphy in the clinical setting. And these are some of the references with the journal articles. This is just a picture of a possible future. We have smart watches, smart rings, smart socks. Any questions?
Have any questions? Reema, that was really good to learn. I have a question. Is there a smart watch or a smart technology that you might want to recommend?
So I feel like there isn't enough data behind it that I would say, oh, this is a great watch to use. Or, even though these studies have been done, they're all done in healthy patients. Do we have any studies done in unhealthy patients? Have we looked at that population?
Yeah, and it is very likely that the healthy population will buy this.
Mm-hmm. Have you guys, anyone on this call, experienced, your patients coming in with such devices, and any recommendations that you may have?
Hi, Reema. This is Dr. Cronin. How are you? Great presentation.
Thank you, Dr. Kernan.
Yes, I've definitely had patients come in with their, sleep tracking devices and their information. And oftentimes I feel like it's otherwise healthy people who are almost like micromanaging their sleep and have complaints that they're not getting enough sleep based on their data. But if you ask them, are they sleepy during the day and all the questions, they really aren't very symptomatic other than kind of being hyper focused on what their devices are telling them. And then have a hard time kind of accepting like, I don't really think there's a problem here, but it's definitely interesting, and I think something that we're all going to see more of in the future.
Absolutely. And I wonder if orthosomnia will be an ICD code or, become one soon.
Yeah, that was not something I was aware of, but definitely something that I could imagine coding for in the future for sure.
Absolutely. Thank you, Dr. Kernan.
Yeah, it was a great talk.
Thank you.
I have a question. For the patient who is not using a wearable but has insomnia and you don't have access to actigraphy, is there any role for a sleep lab to give a wearable out and get a better measure of their sleep than a sleep log will provide?
So the research paper that I had referenced in this presentation, they actually compared actigraphy to these wearables, and some, not all, were pretty comparable in terms of the data that they were providing. Given that actigraphy obviously doesn't give us a lot of information as compared to polysomnography, but there are some comparable data to that.
Well, how do you compare the wearable to a sleep log if you don't have access to actigraphy? In other words, does a wearable enhance the value of a sleep log?
I don't believe so. You would need that sleep log to be able to defend that.
There's a similar question on the chat box. Would you recommend a smartwatch if you don't have actigraphy available? And
We
then another question, would you potentially use wearables to track if positional therapy is treating their sleep apnea? That's a good question.
So I personally, like, we have actigraphy in our office, so we were fortunate to have that, but I would personally be okay with using a smart device to see their sleep and see their sleep patterns, which would help with that supplemental data. Given that with actigraphy, we get similar data in that sense. As far as would you potentially use wearables to track if positional therapy is treating? That is a great question, and something that hasn't been looked into, but something that definitely sparks a question, like something to look into. What would you say, Dr. Bakhtiar, in terms of, I know with positional therapy, we really don't track.
Hey, yes. I mean, if FDA has cleared Apple Watch to detect apnea, then maybe just to see,
Absolutely.
would it guide therapy? I'm not sure, but I think it's not a bad. If the patient has one, why not, right?
Yeah. Any other questions?
No other questions, then I think that's a wrap. Great job, Reema.
Thank you. Thank you so much for everyone joining us.
Take care, everybody.